Colorectal cancer screening latest recommendations. There's a silent clock ticking inside the bodies of thousands of Australians right now, and most of them have no idea. We are currently in 2026, and the landscape of bowel cancer screening has just undergone its most significant shift in a generation. For years, the message was simple: wait until you're 50. But the data has caught up with us, and it's revealing a disturbing trend of younger and younger patients appearing in my Melbourne clinic with advanced disease. Today, I'm breaking down the definitive 2026 guidelines that you need to know, because following the old rules could quite literally be a fatal mistake. The biggest headline for 2026 is the drop to 45. After years of advocacy and clinical trials, the National Bowel Cancer Screening Program has officially lowered the starting age for universal screening. If you are 45 years old, you are now on the clock. You no longer wait for your 50th birthday to start thinking about your colon. In Australia, we are seeing a leftward shift in the age of diagnosis, and by moving the screening age down, we're aiming to catch those aggressive early onset polyps before they become the headlines of tomorrow. But it's not just about when we screen, it's about how. In 2026, the FIT kit, that stool test that you get in the mail, remains our frontier soldier. Even if one sample is positive and one sample is negative, this would overall mean a positive result and should prompt a colonoscopy within 30 days. If that kit arrives in your mail, it isn't a suggestion, it is a precision medical tool designed to find a needle in a haystack. However, the most controversial update in 2026 recommendations involve those with a family history. We have moved away from the one-size-fits-all family rule. We now use a risk stratification model. So if you have a first-degree relative, a parent or a sibling who was diagnosed before the age of 55, your screening doesn't start at 45, it starts at age 40, or 10 years younger than the age of your relative that was diagnosed, whichever comes first. And for those high-risk groups, the stool kit is no longer enough. The 2026 guidelines mandate a primary colonoscopy strategy. We don't wait for blood to show up in a vial, we go in and look, because for you, the stakes are simply too high to play a game of wait and see. We're also seeing the integration of multi-target stool DNA testing into the Australian landscape. This is a step up from standard FIT kit. It doesn't just look for blood, it looks for actual DNA mutations shed by pre-cancerous polyps. While the standard kit is excellent, this DNA-based screening is providing an extra layer of security for patients who are hesitant about invasive procedures but want a higher level of diagnostic certainty. But here's the part where I need you to pay close attention: the symptom override. So a massive misconception in 2026 is that if you've had a negative screening test, you're safe for the next 5 years. This is dangerously wrong. The screening program is for people with no symptoms. If you notice a persistent change in your bowel habits, if you see blood even once, or if you have unexplained iron deficiency, the 2026 guidelines state that your screening status is irrelevant. You bypass the kits and you go straight to a specialist. We're seeing too many cases of interval cancers where patients ignored real-world symptoms because of a piece of paper told them that they were low risk 6 months earlier. The goal for 2026 is simple: 0 preventable deaths from bowel cancer. We have the technology, we have the updated age brackets, and we have the most sophisticated screening infrastructure in the world right here in Australia. But none of it works if the kit stays in the drawer or if you're still following the medical advice of 2010. If you're 45 or older, or if you have a family history and you haven't discussed with the doctor yet, the time to move is now. The rules have changed, and those changes were written to save your life.